All right, guys, so thanks for coming. We were just talking a little bit about this earlier, just little bits and pieces, Dr. Draper and I. But today I'm going to be talking about hyperbaric oxygen therapy. It's a new modality we've added to our hospital, I think back in April. So only have experience of about maybe, about 6 months, 5-6 months. And it's it's a chamber. HVM is Hyperbaric Veterinary Medicine. It's the company that we were approached by, or actually I saw them at the, I believe at the ACVIM conference, and we kind of got into discussions about its applications. They're a great group, been really happy working with them, and they had many years of experience in human hyperbaric medicine, and they put together these veterinary specific chambers. This is a picture of ours right here. And so, hyperbaric veterinary medicine is one of the things where it's a little outside the box. It's a little unusual. Some people would fit it up there with acupuncture, holistic medicine. It's not the traditional modern Western medicine. And I don't know if you guys, mostly of you are younger than me, but Spies Like Us was when I was growing up. It's a great movie that I loved. And Dan Aykroyd's character, this was a line that just always kind of stuck with me. And it's kind of true. If we don't understand something, we either absolutely revere it and have no idea why, or we completely mock it and disregard it. And so, when I started learning about hyperbaric medicine, it was something that I went into with a certain level of skepticism. I said, all right, they're making all these claims. Can it really help all these conditions? And before we really got into serious talks with HVM, I did a lot of research online to look at, like through PubMed, find real peer-reviewed journal articles about whether or not it was efficacious in human medicine, in veterinary medicine, any trials that had been done there, and then also in the laboratory settings, and what its applications would be, and whether or not it would be applicable to something that we do in veterinary medicine as well. And I certainly found mixed results. And so I took home from that, it definitely does not fix everything, but I don't think it should be discounted at all. And I think it just needs to be used in an appropriate case, in an appropriate setting, and not have any unrealistic expectations. So just briefly about the history of hyperbaric medicine. Hyperbaric therapy, so without the oxygen, just pressurized rooms, that was first used back in 1662. They hadn't even discovered oxygen at that point, and basically they would just put people in an airtight room and then manipulate the pressure with these large bellows that they had on the outside. Finally, in 1775, so over 100 years later, they discovered oxygen and were able to, they knew of it as an actual molecule in the air. So at that time, when they were using just the hyperbaric medicine, they used it for various conditions, somewhat similar to what we use it for today. And this is a schematic of what it looked like. So you have the bellows out here with the tubes going into a airtight room, and people would just sit in there and have pressurized treatments. The first use of hyperbaric oxygen in therapy in animals was until 1887, and they did a study, I forget what the quote was, but they basically injected, the quote was, putrid remains of dead rabbits into live rabbits. And then they gave them hyperbaric oxygen, and they lived longer than the rabbits that were injected with putrid rabbits and didn't receive the oxygen treatment. So it definitely seemed to have some sort of medical benefit, but they had no idea what it was. One of the things that we know of it being used for most commonly when you ask the lay people is being used for scuba divers who get the bends. And so even though they started using it in animals in 1887, it wasn't really used until the early 1900s in human medicine. And this was one of the first kind of schematics drawn of how it would be used in human medicine, where it's kind of similar to that room, but you have a person crammed into this little tube, and then they would pressurize the oxygen and treat someone with the bends. So, not going to get into a whole lot of the physics and chemistry behind it, but do have to review it just very briefly, the laws, the gas laws that are associated with this treatment. And the reason I put this up here, Jim Henson, the creator of the Muppets, he's from my hometown. And when I was growing up, we watched the Muppets. I had no idea that he was from my hometown. And one of my favorite characters was the assistant Beaker with Professor Bunsen. And then as I got into high school, I learned that they were based on my chemistry teacher in high school, Mr. Abrams. And actually, Beaker was a good friend of mine, his older brother. He was in the classroom when Jim Henson came in one day, and he made the characters, and you can see it's almost identical. So I always thought that was funny. And whenever I start thinking about science, it always kind of brings me back to that. So here is glycolysis. Don't worry about it. We're not going to talk specifically about all that type of aspect of the medicine, but just there's three main laws that we need to discuss just to give you an idea of how hyperbaric oxygen therapy works. And the first is Henry's law. Henry's law is basically that if you increase the pressure of a gas, you're going to increase its concentration in a liquid. So here you have so many molecules of this gas in the liquid. You then increase the pressure, and it forces the molecules into the liquid, and you get a greater concentration. Fick's law is that the rate and distance that gas will move in fluid is going to be dependent upon the pressure of the gas. So when we think of that in medical terms, it is the transportation of oxygen and carbon dioxide through the alveolar membranes into and out of the blood, and that's based on the pressure gradients. And then Boyle's law is that the pressure to gas volume product is always going to be constant. So if you increase the pressure, you're going to decrease the volume, and vice versa. So take that into context with the physiology of oxygenation and how hyperbaric oxygen would work. The formula for the blood oxygen content is that you have this constant of 1.34, which is associated with the hemoglobin, the number of red blood cells that contain the oxygen, and then you have the dissolved oxygen, which is a very, very small fraction, 0.003 times the pressure of oxygen. So really, the vast, vast majority in a normal animal breathing room air, it's going to be dependent on the red cell count. And then if you take a look here, normal animals, you're going to have 98% saturated oxygen, roughly. So if you gave them nasal O2 or increased their saturation of oxygen, you're really not going to increase the amount of oxygen in the bloodstream. So what we do with hyperbaric oxygen is we were trying to increase the amount of dissolved oxygen. And so the reason we do that, one, is that it will become, that's what's bioavailable. When you have red cells binding to binding the oxygen, the red cells need to release the oxygen into the tissues. The dissolved oxygen will just go into the tissues. And actually, if there's enough dissolved oxygen, the red cells won't release any of the oxygen that's bound to the hemoglobin. So in hyperbaric oxygen, what we do is we put them in that tank. We infuse 100% oxygen into the tank, and then increase the pressure so that combination of physiologic states will actually increase the amount of dissolved oxygen in the blood by about 17-fold. And so theoretically, they've determined that in this state, you could remove all the red cells, and there's enough oxygen dissolved in the plasma to completely oxygenate their body and keep an animal alive. So mechanisms of action of hyperbaric oxygen. Primarily, just like I said there, it's going to be influenced by the effects of the pressure, and then the effects of the pressure then cause changes in the solubility and the diffusion characteristics of gas, so primarily oxygen. And so the main things that we use it to treat, one thing would be gas bubble reduction. So again, this is what we talked about where most lay people know. A scuba diver gets the bends. They go down 60 to 90 feet. They are breathing oxygen at or they're breathing gas at a increased pressure. And so when they're down below, that pressure is going to cause the gas bubbles and the air bubbles to be small. And as they breathe them in and then they start to rise, the pressure decreases as they come up to the surface, and those air bubbles are going to expand. And so if they come up too quickly, and the gas bubbles become too large, it can cause the decompression sickness, which is the bends. And so basically, in cases like that, they get put in a hyperbaric chamber, and the pressure will decrease those bubbles back down to the size that they were when they breathed them in initially, and gives the body time to equilibrate and remove those gas bubbles. Other things that we can use them for in veterinary medicine or in human medicine to take advantage of this would be an air or gas embolism, which we don't really see, or at least we don't recognize it in veterinary medicine. I think it's something that's probably more common in human medicine, where if gas were to get into an IV line or injected accidentally, it can cause catastrophic event. And so this would be great for treating a case like that. Something more along what we treat would be gas accumulation inside in intestinal tract. So if an animal has post-op ileus, it can be really beneficial for that. Even in human medicine, they find it to be very beneficial for post-op ileus. And I've seen it do pretty amazing things with some dogs that were just vomiting and vomiting and vomiting after surgery. And you take films, they've got diffuse ileus, you put them in and into the chamber, and they come out and they start eating, and they're doing much, much better. So I think it definitely decreases the volume and helps eliminate the gas in the intestinal tract. Other ways to use it would be to improve oxygenation. So again, what we're doing is we are going to increase the amount of dissolved oxygen in plasma. So there's going to be oxygen available to the body to be used. Doesn't rely on the red blood cells to be transported. It doesn't rely on hemoglobin to release the oxygen. And so basically what this would be beneficial for is, I mean, you can imagine just many conditions that we see. Smoke inhalation, methemoglobinemia. It's helpful this is one of the mechanisms it's helpful for wound healing, because the high oxygen content actually induces fibroblast stimulation. Blood clots, if you have blood clots like an aortic thrombus, or even like a PTE or a brachial artery thrombus, that's going to cause stasis. The red cells, which are less deformable than just the liquid plasma, are not able to get past those clots. So if any fluid is able to get past, and without the red cells, so just plasma, if that's carrying increased oxygen, it's going to be able to get to the hypoxic tissue and hopefully save some of it and make it give us some time to get rid of the clot or to let the clot dissolve. And then obviously anemia like IMHA, or a dog that's hypoxemic, it's going to increase the amount of dissolved oxygen. You won't rely on the red cells to transport it. Can make them feel much, much better. Another mechanism that hyperbaric oxygen therapy can help various conditions is that it induces vasoconstriction and in normal tissue. So some people would be concerned that as you cause vasoconstriction, if you're going to induce hypoxia to the tissue, because not as much blood's going to be getting to it. However, due to the greater bioavailability of the dissolved oxygen in the plasma, you don't have to worry about that. It compensates for the vasoconstriction. And so this is applications really for like edema and bruising, spinal cord, brain, soft tissue, any of those parts of the body that have any sort of swelling. And it's going to help by, one, reducing the blood vessel size. So this is really important in intracranial pressure. It's going to decrease the blood vessel size, so that's going to decrease the blood volume inside the skull cavity. It's also going to result in reduced edema in a couple of ways. It just helps with elimination of the edema that's there, and then also by normalizing the oxygenation to whichever tissue it is, you're going to get reduction of cytotoxicity or destruction of the cells, and then you get less release of the intracellular fluid, and decreases edema through both those mechanisms of action. It also has a antibacterial activity in a couple of ways. One, it directly works and enhances the body's antimicrobial activity. Basically, it does that by restoring the tissue oxygen levels. And what they have found is that these normal or hyperoxic conditions are needed by the white blood cells to help kill bacteria. It helps with the mechanisms. They use oxygen radicals within their within the cells, within the white cells, to destroy the bacteria. So it helps with their phagocytosis. And it also helps with penetration of antibiotics through various mechanisms, one of which is going to be through angiogenesis, where it actually helps penetration of the antibiotics into certain tissues. With inflammatory and immune-mediated diseases, this is something that I've seen it, read it, and seen it used personally in quite a few cases, and it's been really, I've been really happily surprised with the success. And experimentally, they have shown that it decreases the severity of autoimmune diseases. It's been shown to improve graft and transplant tolerance.
How long, with the autoimmune disease, how long would the effect from a treatment series be?
Right, so it would be ongoing. One treatment's not going to take, I mean, it might help for a short period of time, but it's something that needs to be ongoing. And I discuss it in a couple of the cases I've used it in towards the end of the lecture. But I mean, in human medicine, they'll do it for like 30 treatments. It starts to get cost prohibitive with veterinary medicine, but we try to do it. It kind of vary case by case based on their condition, how they're responding, owner finances. And I have a couple of examples both with infectious and autoimmune diseases. One thing that I don't have later in the lecture that they've found is that it's very, very successful in treating Lyme disease. And it had something to do with, like they had severe refractory cases. They could not get it to clear. And, you know, we know about how we treat it with doxy long term, but it still seems to be there. Is it cleared or not? And it has to do with the Lyme organism's susceptibility to oxygen. Like they did studies outside of the body where in a hypoxic environment, it survived various treatments and exposure to the environment, but when they increased the oxygenation in the, again, this was all outside of the body, when they increased oxygenation levels, the organism became very susceptible to treatment. So there's been several case studies in human literature that it's been very, very helpful with. Angiogenesis is another way that this helps. This is more of a long term. It's obviously not going to cause an immediate effect, but it'll help get blood vessels to grow into either somewhat normal tissue, like disc spaces that are normally poorly vascular or avascular. I believe even like some cases of leg calves Perthes disease, it's been used in human medicine. I don't know of any reports in veterinary medicine with that condition. And basically, you need an oxygen gradient to induce angiogenesis, and this helps create that gradient. It hyperoxygenates the tissue where the plasma is able to get to, and then the blood vessels are going to grow into the less oxygenated tissue. So certainly not without complications. Just as any treatment we do, you always have to weigh the risks and the benefits. And so the most common problems that we'll see with hyperbaric oxygen in human and veterinary medicine would be middle ear rupture or sinus pain. And think about it, it's basically going up and down in an airplane or diving down below the water, the changes in the pressure. If you can't equilibrate, like if you have a sinus infection or a nasal infection, and you can't equilibrate the pressure between your middle ear cavity and the external air, then it's going to cause pain. And so to combat that, you know, with people, they'll tell them to hold their nose and cause pressure, and that'll open up the eustachian tubes. We obviously can't tell pets to do that, so when we increase and decrease the pressure, we just do it very, very slowly over about 15 minutes or so. So it's generally not a problem, but if we see them scratching at their ear or showing discomfort, we'll slow down the pressurization. Lung rupture, again, that would be something you would expect if there was some sort of lung pathology or if there was trauma. But if you go slowly, again, it shouldn't be that much of a problem. You just let the gas equilibrate across it. Oxygen toxicity, there's two main types. There's the direct oxygen toxicity to the lung epithelium, that if you had a dog on a ventilator, like receiving 100% oxygen, You can only do that for 12, 24, maybe 36 hours before it actually starts to damage that lung epithelium. When we have them in our chambers, they're in there for an hour, hour and a half at the most, being exposed to 100% oxygen, so it's generally not a problem. But seizures, oxygen-induced seizures, we see surprisingly frequent. And it's not really a problem. Every single one that I've seen and everyone that I've talked to who's ever seen them, they stop as soon as you start to lower the oxygen and lower the pressure in the chamber. One thing that we talked about earlier, one of the mechanisms is that it causes vasoconstriction. So if you have an animal in heart failure, that's kind of a contraindication to putting them in the chamber. Sounds like it would be a great thing. It would help get rid of the pulmonary edema. It would help oxygenate their tissues. However, the vasoconstriction is going to make it more difficult and for the heart to work and increase the load on the heart. And so theoretically, you could worsen heart failure. So decompression sickness, basically, when we put them in the chamber, we are sending them on a scuba diving trip. We put them in the chamber. It's just, obviously, it's not with water, but we are pressurizing the chamber to about roughly equivalent to someone scuba diving to about 60 feet deep in the water. So just like people who breathe in oxygen and nitrogen at depths of 60 to 90 feet, they have to come up slowly, otherwise they can get the bends. So we have to worry about the same thing with animals that are in the chamber. We have to bring them up to normal pressures within, usually within 10 to 20 minutes slowly to avoid that decompression sickness. Combustion, this would be a major, major problem. Very, very rare, but we're in a 100% oxygen environment in there. And so that's going to be a flammable gas. And it was at an equine facility in Florida, I believe, last year or 2 years ago. And it was a very large chamber, one where a person could actually go in with the horses, put the horse in there. They did not take off his shoes, and it sparked, and the entire chamber blew up, killed the horse, killed the technician treating him. So that is something we really have to look out for. I hope I never have to see that, but there's lots of precautions we take to try to avoid that. In human medicine, they talk about coincidental medical events that may occur while a person is receiving hyperbaric oxygen therapy. They feel that they have these listed as coincidental medical events, basically saying that a lot of people are being put in these chambers with underlying medical conditions that would predispose them to this, and that they do not think that hyperbaric oxygen is responsible for it. So they could develop a stroke, myocardial infarction, focal seizures in patients with history of epilepsy or an intracranial lesion. They don't think it's necessarily due to just the oxygen therapy. The real major contraindication would be an active pneumothorax. So that's really the only major true contraindication. And I think if there's a little bit of gas in there, it's not going to be a problem as long as everything's sealed. Again, you just pressurize them and depressurize them slowly. But if you have an active leak leading to pneumothorax, you're going to have them on breathing in pressurized gas. So the pressure of the inhaled gas is going to be greater than the pressure of the gas that's inside or outside of the lung and inside the thoracic cavity. So the gas is going to go from the high pressure to the low pressure, so it's going to worsen the pneumothorax and cause worsening of a collapsed lung. So we definitely don't want to put them in there if they have an active pneumothorax. We have put cases in, though, that are trauma and have a pneumothorax but are stable. There hasn't been any worsening over 24, 48 hours. So it's not, it's only when it's an active acute pneumothorax. So there's a few medical considerations that you need to always be aware of when we're doing these treatments. Essentially, as far as the FDA is concerned, this is considered a drug, and so you need to concern yourself about, are there any drug-drug interactions, species differences, and some of the drug-drug interactions or the drug interactions with hyperbaric oxygen are beneficial, some of them are detrimental. It can improve antibiotic efficacy, either by helping the body's own defense mechanism, but also by improving blood flow to poorly vascularized tissues, and also by improving permeability of certain tissues to these drugs as well. Using it with radiation therapy is a big area of study in human medicine. It can, and also with chemotherapy, but a lot of it is with radiation therapy. They're trying to figure out the best timing with it. In certain windows of time, before or after radiation therapy, it can exacerbate toxicities. If you give it during treatment or immediately after hyperbaric oxygen treatment, the radiation therapy is more likely to be effective. So they're trying to figure out when and how to use it in those cases. With chemotherapy, certain types of chemotherapeutic drugs will be made more likely to be toxic, depending on which drug, and some of them they find to be more beneficial in their efficacy against different tumors. One thing that isn't really a problem, you just have to be aware of it when we put an animal in the chamber, is that it does increase insulin sensitivity. So if we have a diabetic patient that we're going to be putting in there, we definitely give half the dose or hold off on it. We'll check their glucose before they go in. It's just a temporary hypersensitivity to it, so it's not an ongoing problem. And then drugs that may affect the blood pressure we have to be aware of, because it's going to cause vasoconstriction. So on occasion we need to sedate dogs and cats to put in there. We don't want to use dexdomitor because that's going to cause vasoconstriction. And if you put them in there with that, it's going to potentially cause a dangerous hypertension with the synergistic effects there. Promazine is going to be safe, relatively safe though, because that'll cause vasodilation, and so they might counteract each other. They certainly don't exacerbate each other. If a dog is on, or a patient's on, some sort of like phenylpropanolamine, you have to be aware of that causing some effects on vasoconstriction. And there might be an interaction there, but other drugs like beta blockers, things like that, that could be vasodilators. Generally, you just have to know that for a short period of time, it's going to negate the effects.
Do you see with ACE already lowering the seizure threshold that they'll have more seizures as a side effect? Or not really?
I've not seen it.
Okay.
Then the question is, does ACE cause seizures? Curious to get your opinion on it. I think it does, but I don't care. What do you think? What's been your experience?
I don't think it does. I think the one phenotyping that they did link to reduce seizure threshold in people was prochlorperazine, I think.
Mm-hmm.
But I have used ACE in tons of seizure animals.
Yeah, I agree. I definitely use it in dogs that are seizuring if they need it. And but so it doesn't. I don't get squeamish about it. But I just, in my opinion, I think I've seen temporal relations. I've seen dogs that get oral ACE and seizure. I've had like 2 cases of that. Maybe they're going to seizure anyway. I don't know. But I've seen it enough that I just think that there may be an association. But I don't think it's. If they seizure, it stops. You give them Valium. It's no big deal. But I'm trying to think of the patients that I've put in there. We usually don't need to use ACE. I mean, usually they go in there and they do just fine without it. I don't think the ones that have received ACE were any more likely to have a seizure. Although, really, I mean, I've only been doing this for 5 months now. I am far from an expert. So, in human medicine, as usual, it's all money, who's covering, who's paying for what, is Obama going to pay for it, or is Banner going to pay for it, and is Medicare going to pay for it? And so there's a list of conditions that is approved by Medicare, the insurance companies, that they will cover for hyperbaric oxygen in human medicine. And so this is it. There's about, I think it's 15, 17 specific conditions. The big one are diabetic wounds. But even then, it's only if they've tried traditional treatment and it's just not responding. Skin grafts, chronic refractory osteomyelitis. So if someone has an acute osteomyelitis that hasn't been even attempted to be treated, they won't approve it. And then these are the acute conditions that they'll treat. Very similar to what I was talking about before. So like carbon monoxide intoxication, arterial insufficiency and clots, trauma, crush injuries, compartmental syndrome, things like that. And so these are the conditions that will just be covered outright. Then there's what are considered, UHMS is the Undersea Hyperbaric Medical Society. I don't know if they have any jurisdiction over anything. I think it's just a society of people that got together, and they are big into hyperbaric medicine, and they've come up with a list of conditions that they think are pretty much proven. They feel there's enough evidence to support saying it is an indication for it. And so it's a lot of the same stuff that you see on the previous slide, and then there's a few others, such as, gosh, you know what, I don't even see the diabetic wounds on here, but maybe these are in addition to it, but so there's some overlap. There's a few on here that they feel should be accepted as an indication. And then you have the non-approved research conditions that the Undersea Hyperbaric Medical Society feels that there's preliminary data to support further research for. And they're very willing to do support studies and try to find out if we can do it. A big one is autism. There's a lot. I found a lot of articles on autism. Speaking with someone who does hyperbaric medicine, he said he's had huge success with autistic children. What else do they have here that's kind of interesting? One thing that I thought was interesting is like strokes, are acute cerebral edema, are in the non-approved research conditions list. Brown recluse spider bites is in the non-approved research conditions, because a lot of this is very similar to some of the conditions that they feel are approved and proven to be expected to work. But here they also have cardiogenic shock, which is a little weird because you're going to cause vasoconstriction. So it's a lot of unknowns, and they're trying to figure out where it's applicable and where it's not applicable. Fortunately, we don't have to deal with, the only people we have to deal with are our own conscience and the pet owners. So this is a picture of our chamber. This is looking at it from the side. We have these 3 little port windows. We can look in and the pet can look out. This is looking in from the doorway here. This table slides out, and then we slide them back in, seal the chamber. And this is just a little video of what we do to get a patient ready. So the first thing we want to do is reduce the likelihood of there being combustion. So we spray them down with water to get rid of any sort of static electricity. We use 100% cotton towels. You don't want to use any artificial fibers that are more likely to cause static. That is, I was showing the cotton bandage we have over catheters and things like that. Then we put them in, just hand-tight seal of the chamber, so it kind of looks like a little submarine. Next thing we do is we start infusing the oxygen and adjusting the pressure, and there's different gauges to tell us what the pressure going into the chamber is, what the pressure in the chamber is. And then they go down, they're pressurized, we monitor them on these screens or through the window. You can see this dog, he was not sedated, he was just laying in there calmly. And then when they're done, they're in there for about an hour, hour and a half. And then we depressurize them and take them out. So, like I was saying earlier, I think that there's a lot of unknown. What is it going to be used for? Is it just snake oil, or is there an actual indication for it? And I certainly wouldn't recommend anything to anyone that I wouldn't recommend for my own pet. And so this is my dog RJ. She was in there 2 weeks ago post-op for a cruciate ligament surgery. She had a TPLO. And I put her in there to, one thing that I didn't mention earlier is it's been shown to be very beneficial for just pain, regular post-operative pain, acute pain, reduces swelling, bruising and edema in the soft tissue. And so I put her in the chamber for about 4 treatments over 2 or 3 days after her TPLO surgery. And she's a pretty anxious dog, and you can see she's in there pretty calm. Kind of looks like she's in a dryer here. This was a closer picture of the window. And I didn't do it just so I could say I put her in there to clients. I put her in there because I honestly, genuinely think that it works based on my experience with some of these cases. And so I'm just going to kind of go through a few of these cases that I've used it on or that I've seen it used on. Any questions so far? So this first case, this was like within the first week that that we had it. I had a 12-year-old bulldog that came to me for a week of progressive tetraparesis and severe neck pain. Did an MRI. This is pre and post or this is a T2 axial. This is a T1 post contrast, and you can see this black area here. That's the vertebra, and then you can see it's completely absent on this side. The bone's been completely eaten away. This right here is the spinal cord. This is all a tumor that had basically destroyed all that tissue and was causing severe compression of the cord. So woke her up from the MRI so I could talk to the owners, and as all good bulldogs do, she started becoming very stridorous. She was cyanotic. She was required being placed in the oxygen cage. I didn't put her in a chamber. We just put her in an oxygen cage. Gave her a little sedation. She recovered uneventfully within a few minutes. So sat down, had a long talk with the owners about options, surgery, radiation therapy, prednisone, all that fun stuff that we talk about. The owners elected surgery. So the next day, went to perform the surgery, and when we went to intubate her, you could see just, you know, the huge, the saccules, the severe laryngeal and pharyngeal edema from the previous intubation. And so I was pretty sure that when we extubated her, it was going to be a bit of a nightmare. And I was right. When we extubated her, she was so much worse than she was the day before. We could not even put her in an oxygen cage. Wasn't enough. She was still cyanotic and really having a lot of difficulty breathing. So very quickly placed her in the hyperbaric oxygen chamber, and within about 5 minutes of getting the oxygen up in there, because again we're getting much better oxygen levels. It's close to 100% oxygen in the chamber, which really in a animal outside of the chamber we could only do if they're intubated. And then, whereas in a oxygen cage, you're looking at anywhere from 30 to 40% if you're, depending on how leak-proof it is. So she pretty much fell asleep within 5-10 minutes. Stayed in there for an hour, decompressed her over about 15 minutes, took her out, and it was probably the best she's breathed in her entire life. She didn't even have like the lips being pulled back like bulldogs do. It was quiet. And she was comfortable. She was moving her head around, and the surgical approach that I did was like a dorsal to a hemi. Tons of soft tissue dissection. They're usually very painful after that. She was moving her head around as if it was nothing, shaking her head, and so I think it had, a couple of ways that it helped her. One, it increased the dissolved oxygen in her blood, so she was better oxygenated. She wasn't as reliant upon the red cells to move it around. And then also it decreased the swelling, both the surgical swelling within the soft tissue, but also the swelling and edema within the larynx and pharyngeal area. So another case similar to that, not so much with the upper airway, but within that first week or two that we got it, was a lab that had a lateralized disc. It's not this case. Again, did a cervical hemilaminectomy, a lot of soft tissue dissection and trauma, and after surgery she was in excruciating pain, even more so than prior to surgery. She would just stand there, she wouldn't move her neck at all. Put her in the chamber, and when she came out an hour later, she was wagging her tail, she was moving her head around. She hadn't gotten any other additional post-op meds. It was all from the hyperbaric oxygen, and that, again, that was one of my first experiences with it, those two cases, and I was very quickly becoming a believer in its efficacy of post-op pain and also for upper airway and oxygenation problems.
How long until you saw the recurrence of the pain you would expect?
I put her on a CRI after that, and she was pretty much comfortable. I treated her twice a day, well, once that first day, twice the next day, and then once the third day. This next case is a condition that I've seen really good success with. So meningoencephalitis of unknown etiology, granulomatous meningoencephalitis, necrotizing encephalitis, there's all these different names that we like to sit around and decide the new name this year for this condition is going to be X, Y, or Z, but really it's an autoimmune meningoencephalitis is essentially what it is. And we see it commonly in adult small breed dogs. So this one case was an 8-year-old Westie that came in to see me for several weeks of progressive head tilt and a seizure. And basically the exam was consistent with vestibular disease, and given the seizure, it was something central. We did an MRI, and you can see these are the this is a pre-contrast study. These here, and these are the post-contrast, and you can see that there's quite a bit of contrast enhancement multifocally throughout the brainstem. CSF was inflammatory, non-infectious, so diagnosed her with autoimmune meningoencephalitis. And at that time, this was about 18 months ago, so we didn't have the chamber yet. Started her on any number of standard protocols. We did prednisone and gave her a bunch of options for other non-steroidal immunosuppressive drugs. So mycophenolate, azathioprine, lomustine, cytosar. The owners elected prednisone and mycophenolate. Could not lower the prednisone dose. So, and the dog was having horrible, horrible side effects, so we decided to add in cytosar as well as an injection every 3 weeks. Still, 18 months of mycophenolate, cytosar, and prednisone, we were not able to get the dog off of prednisone. We had to have her at high, like 1 to 1.5 mg per kg a day. This dog was getting horribly cushingoid, had no hair, panting, pot-bellied. I mean, just your classic case of a dog with Cushing's disease. And so finally we got the hyperbaric oxygen chamber, and I said to them, I was like, you know what, let's try this, let's see what happens. And the reason I got the idea for this case was talking with a neurologist down in Florida who is a big proponent of it. He's been using it for 5-6 years. He told me about a case of his that it's his own pet with GME, biopsy confirmed, multiple MRIs, it's ongoing inflammation. He has the dog out 5 years, completely off medications, and he gets hyperbaric treatment every 8 to 12 weeks. As those 8 to 12 weeks come up, the signs start to come back. He puts them in the chamber, the signs go away. So, and that's the only medication that he has him on now. So I said, let's see what we can do. So put her in the chamber, did 60 minutes at 1.5 absolute pressures at 1.5 ATA, and did that every 3 weeks when the dog would come in for the cytosar treatments. And 6 months after doing that, I've gotten the dog completely off prednisone, where I could not even come close to doing that before. There had been no regression of signs. All the prednisone side effects had resolved. The owner is just ecstatic about how the dog's doing. And now I'm starting to taper off the mycophenolate. Just going to do the cytosar and hyperbaric treatments for a period of time, and then see if we can get off the cytosar as well, and then try to space out the treatments with hyperbaric oxygen. So again, I was like, this is kind of impressive, becoming more and more of a believer. So this dog, this little video, this dog has, it's another case of GME. It's a 1-year-old Chihuahua, came in for behavior changes and circling, just constantly circled to the right, had absent vision in the left eye with an intact pupillary light reflex. So consistent with a right cerebral or right forebrain lesion. This is just video to show the absent menace in the left eye. I haven't had a chance to upload the video. I got video of this dog like 2 weeks ago, completely normal now. So this is that dog's MRI. You can see relatively normal area of the brain. Here you can see all this white, which is edema. And here you can see it on the axial, all this white matter swelling and edema. It's on the right side, fits with the signs that we were seeing. Spinal tap was inflammatory, no evidence of infectious disease on additional testing. So at this point, we had the hyperbaric chamber already. This was a more recent case. Started her on prednisone and cytosar, also administered hyperbaric oxygen therapy every 3 weeks. And 3 months later, the dog's completely normal, and I have her off prednisone already. Not to say it's not the cytosar. That, to me, I don't know, it's pretty quick for me to get them off prednisone entirely if I was just doing cytosar as well. Do you feel the same way? So right now, we're about 4 months out, still off of it, off of the prednisone, getting hyperbaric and cytosar treatments. The hyperbaric I'm actually doing every 6 weeks now, so every other cytosol treatment. And eventually I'm going to start to taper off the cytosol treatments and see how the dog does. So to me, the impressive part is just how quickly I was able to get him off the prednisone, which to me, if it was my pet, that would be my least favorite drug to have him on. So ways that the hyperbaric oxygen will work with these cases, it decreases the swelling and edema within the brain. It's going to decrease the inflammatory and autoimmune response and may also allow better drug penetration into the brain. Again, this was a huge case that made me a believer early on. This was a lab that was owned by a referring veterinarian, and it was a 9-year-old male castrated lab that presented to our North practice with a severe fever of 104, 105 degrees. They had it up there for a week at their building, treating with IV Unison, IV Batril, and doxycycline. They did all the infectious disease testing, abdominal ultrasound, spinal rads, chest rads, urine cultures, blood cultures. They could not find a source of the fever. So they sent him down to me to see if there was either, they were suspecting possibly meningitis. My exam was pretty normal except for some multifocal spinal pain, and did an MRI, and what I found was multifocal discospondylitis. And so you can see these areas of brightness both within the disc space and contrast enhancement around the vertebrae and disc space up into the nerve roots. Here's contrast enhancement underneath the vertebral or the intervertebral disc space. So this dog had discospondylitis. It was not responding to the pretty aggressive treatment that they were treating him with up in the other clinic. And the main reason for that it's difficult to clear these infections of discospondylitis is that there's poor antibiotic penetration into the disc space. It's not a very vascular area, so it's hard to get the antibiotics into that. So after we did the MRI, talked to the veterinarian about doing hyperbaric oxygen, put her in the chamber. Within 3 to 4 hours after the first chamber treatment, the fever completely resolved. And we were doing the same exact treatment they were doing up in our other facility. So we did IV antibiotics and daily hyperbaric oxygen treatments for 5 days, remained afebrile, and we're out 3 months now on oral antibiotics, and I'm doing hyperbaric oxygens just kind of as needed to keep the dog comfortable, because the owner definitely felt that every time she would bring him in for a hyperbaric oxygen, he would go home with a better spring to his step and just seem more comfortable for about a week, 2 weeks, 3 weeks, and then the signs would start to come back, the discomfort would come back. So I don't know if that discomfort is coming back because the analgesic effects are starting to wear off, or if we're starting to lose the antibiotic penetration. And also, as I mentioned earlier, it also causes an immune response, or improves the immune response within the body itself, not just the penetration of the antibiotics. So this was a head trauma case I saw. It's an 11-year-old Chihuahua attacked by a Labrador 2 hours prior to presentation. Video of his presenting exam. He is not normal. You can see his right eye is kind of bulging out of his head. His tongue's hanging out. He's non-ambulatory, inappropriate mentally. He had positional vertical nystagmus. Absent menace in the right eye. There I was just checking the doll's eye reflex, which were intact, but it's kind of hard to see in the video. And I hate this part of the video. It was poor form on my part. When I turn him over, the head kind of snaps back a little bit. Don't do that. Not with head traumas. You can see a little vertical downbeat nystagmus. Here it is in slow motion. So there you get a beat. Again, another one. So it fit with kind of a multifocal, so either cerebellar brainstem or multifocal condition. So it did both MRI and CT to look at the soft tissue and the bone respectively. So here's an MRI. Here is edema within the soft tissue. around the base of the skull. And here is the coronal view. You can see this is where the back of the skull is the base of the skull. You have some edema within the cerebellum here, and then in the soft tissue outside of it. And then a CT through that same area, you can see a little bit of a non-displaced skull fracture right here. So basically there was trauma to that part of the brain. I didn't want to go in and fix this. I figured it's non-displaced. I'd probably cause more problems than solve. So did typical supportive care, and then hyperbaric oxygen therapy daily. Here's a picture of the dog inside the hyperbaric oxygen chamber, sleeping, comfortable. And then this video was 2.5 days later. So still not normal, but doing much, much better. In a case like this, maybe this dog was going to get better. I was not convinced by this case, because I've seen them get like this within a couple of days anyway. But it was a good example to me. The other day, just this past weekend, I had a case. I wish I had pre and post video because I would have put it on here. But to be honest, I went into it, I was like, I'm just not terribly optimistic. I don't know what's going to happen here. But a dog presented in very similar condition, probably a little bit worse, completely non-ambulatory, severe torticollis and twisting to the right. Put her in the chamber, and when she came out, she stood up. And so this was within hours. Again, maybe it was going to happen anyway, but the case I saw this weekend, I was pretty impressed, much more so than I was with this case that I just showed. But it's one of the potential uses that we have for it. Snake bites. We see, do they have rattlesnakes up here?
Yes.
Yeah? Okay. We didn't have them in Charlotte. We definitely didn't have them in New York. And they are killers down in Charleston. These canebrake rattlesnakes. So here's a couple of cases that I didn't have any of my own pictures, so these are some cases that have been sent to me from some clinicians in Florida, but we've used it on a lot of snake bites and been very, very impressed with it. It's just that the emergency doctors keep forgetting to get pictures for me. So this dog presented for a canebrake rattlesnake bite on the 4th of July, received antivenin. 3 days later, it still looked like this. And was starting to get necrotic. They had a surgeon evaluate it. Their recommendation was to debride it, and probably it was going to need grafts and flaps. The owners weren't terribly happy with that, apparently, so they wanted to get a second opinion. They went to another facility that had the hyperbaric oxygen therapy, and they did treatments over 2 or 3 days, and it went from this to that. Again, maybe this was just going to happen. But they had waited 3 or 4 days and there was no improvement whatsoever. Surgeons felt that it was bad enough that they were recommending skin flaps and grafts. So it went down pretty impressively over just a couple of days. Just a little support for it. Here, this is a case that had a pygmy rattlesnake bite. No antivenin was given, and I don't know if you can appreciate it. Here's the tongue right here. Here's the tongue here on this after picture. Here is this huge edematous swollen tissue within the mouth causing compression, pushing up on the tongue there. So they didn't do antivenin for whichever reason. They did treatments over a couple of days and without any additional treatments, no steroids, which was kind of contraindicated anyway, but no additional treatments. All they did was the hyperbaric oxygen. Within a couple of days, the swelling had completely resolved. More importantly, what our experience has been, even if that swelling is going to go down anyway, is it definitely makes them much, much more comfortable immediately afterwards. And so that's one of the major benefits of it. This case came to our surgeons. It was a bull mastiff that had been found after missing for 4 days. It had then been at the referring vet for 3 days for IV antibiotics and a small minor debridement. There was no improvement. Actually, this was getting worse. So this is what it looked like when it came in. All this necrotic tissue right here down at the hock, all this edema and bruising. Weren't really sure what was going to be viable or not. So got a culture from it, did very minimal debridement, did hyperbaric oxygen treatment. This is him being put into it. So we can get pretty big dogs into it. We got this bull mastiff into it. And then here's sequential pictures. So this was at presentation. This was 12 hours after the first hyperbaric oxygen treatment. So Just debrided this little bit of tissue right here, but you can see this area right here would be this tissue right here. So it looks much more vascular and vital. And then this was a day and a half after just hyperbaric oxygen therapy. And so markedly improved. And I'm not a surgeon, so I asked the surgeon, I said, is that impressive? And he said, yes. So this, I don't need to be a surgeon to know is impressive. Again, a dog that had been attacked by other dogs and then disappeared for several days, was being treated at the referring veterinary hospital with IV antibiotics and hydrotherapy. There was no wound debridement or surgery performed. And over 5 days, they did 8 hyperbaric oxygen treatments. And this is what it did on its own within 5 days. So all this repaired itself. There's obviously, it's far from complete, but pretty impressive without any sort of surgical intervention whatsoever. This is a case that was sent to me for suspected disc disease, like cervical disc disease. Turned out to be a brachial artery thromboembolic event. But this would be another case that's very good. Here's the video of them. You can see why. You could definitely think it was like a nerve root signature. But basically came in, severe left forelimb lameness and weakness. That's her trying to get him to walk. No deep pain in the distal left forelimb. It was cold to the touch. The blood in that limb had a very low blood glucose compared to this other limbs, so it fit with a brachial arterial or brachial artery clot. So they chose to put this dog to sleep, but certainly hyperbaric oxygen would be something to consider in this case as well, to help with dissolved oxygen within the plasma to try to get past that clot if there's any chance of it getting through. So, and I think this is the last case. I call this one Dr. Ludwig's hyperbaric epiphany. So I don't know if you're familiar with Dr. Ludwig. She's one of our surgeons at our facility. She's a very skeptical person. She was not embracing this hyperbaric oxygen therapy at all. She would laugh at me every time I mentioned it. And she had this case. It was a dog that was hit by a car, had horrible degloving injury to the right hock. They closed it. And the next day, there was horrible compartmental syndrome to the leg. It was swollen. You could barely feel pulses. It was cold to the touch. And the dog was in absolute agony, screaming. If you went near it, it would attack you. So that was on like a Sunday. I wasn't there. She put it in the hyperbaric oxygen chamber. And the next day, she told me when the dog came out, it was wagging its tail and licking them and letting them pet her. So she was really impressed with the relief of the pressure and the pain that the dog experienced with it. So the next day, the dog started getting aggressive again. They put it back in the chamber. Same thing happened. And then I was like, well, let's get video for today's treatment. And so you can see here, when she reaches in, she's very cautious. She's pulling him out. And like he makes a move, and she like jumps back right there. And it was kind of a letdown because the dog was a lot more comfortable at this point. And so it would let us manipulate him. But this is before he's going in for like his 3rd treatment. There's still quite a bit of edema and swelling. And I don't know if I'm going to sell you on this, but it was definitely palpable. And we're trying to show it on the video. If you see there, it's full. It's fluid filled. And this is after treatment. It's kind of flat and empty. It's just like loose skin. And I'll show it again. So this is before the treatment. It's just edematous and full. You can see it springs back into shape. And this was much more evident on palpation. And so there you squeeze it and you see it almost collapses. And that was because a lot of the fluid had been basically squeezed out, for lack of a better term, I think. And the swelling had gone down, but there was still just a stretching of the tissue, and it was like an empty sac at that point. But I would not argue with you if you told me that you didn't believe it without feeling it. So, you know, that's a lot of the use, just a handful of the uses that we've had success with over the last 5-6 months. Again, like I said, it's not a cure-all. We don't put anything and everything that comes into our hospital into it. We have to talk about, you know, the finances of it. It's about $175 per treatment. And so, if people have limited funds, we'd much rather put that money towards hospitalization, supportive care, the more traditional treatments. But there's definitely been some cases where it helps get them out of the hospital faster, it makes them more comfortable. The way I present it to owners is that, like with my disc surgeries and spinal traumas, is that I don't know if in the long run it's going to make a difference in their recovery, but I definitely think it makes them more comfortable in the short term, acutely, post-operatively, and it may speed up their recovery. That's something I would like to get a study going at some point between myself and some of the other neurologists that have this, and see if we can't figure out if it actually does cause or improve recovery. But definitely I've seen it make them more comfortable. So that's how I present it to them. I say, it's going to be, we do an additional 2 to 4 treatments while they're in the hospital. And then depending on how they're doing after that, they may come back for more depending on how paretic they are. But for the acute treatment, we'll do 2 to 4 treatments. It'll be an additional $350 to $700. If that, is going to make or break the treatment and the care for the dog, I would much rather not use it and just go with the traditional treatment. But if they're able to, then we'll add it into their treatment. Same thing for all those other conditions. Some of them with like the severe wounds, we'll push it a little bit more, like the snake bites, things like that. I don't know about up here, but at our hospital, I think like a bottle or a treatment of antivenin is like $900 or something like that. So it's expensive. And we've treated dogs with snake bites with just hyperbaric oxygen and no antivenin. Turned out to be a lot less expensive, and we almost see the same results. So definitely has its benefit. I'm big on evidence-based medicine. I do think outside of the box, and I'm supportive of like acupuncture and some things that I think we just can't explain. But I also need to be able to kind of sleep at night and not think that I'm pulling the wool over someone's eyes and making them do a treatment that really is just useless and not going to help them, and we're just doing it for the money, because that's not the case. And I always try to make it very clear to the owners that that's not the case. The way I see it is, it doesn't cure everything, but the other stuff that we're doing doesn't cure everything either, yet we still continue to do it. So that's just kind of my take on it. Any questions?
I know in general, with most cancers, hyperoxygenation is good at killing cancer cells. And I do a good bit of alternative medicine where we'll go with a more holistic chemotherapy route.
Mm-hmm.
Have you used it much in treatment of cancer minus chemotherapy and radiation?
I have not. Yeah, I've not. And that's one of the things I've been doing a lot of reading about, and I'm still trying to figure out what the field is in human medicine, and they're still trying to figure it out too. There's some concern that it could actually worsen metastasis, and there's some concern that it could help treat it. Like I said, there's certain chemotherapeutic agents that the toxicity will be exacerbated by hyperbaric oxygen, others that will be made synergistically more efficient or more efficacious. And then what they're trying to figure out is that some of them, if you give it, as far as radiation therapy goes, if you give it while they're getting radiation therapy, which is virtually impossible, it's going to be much, much more beneficial. So what they've done in people, they're doing studies with radiation therapy where they give the hyperbaric oxygen and immediately whisk them into the radiation therapy, and they're finding that that's more beneficial too. There's a window of time though where if you do it before or after a certain amount of time where it can actually potentially worsen things or have no benefit. One thing that it's very beneficial for is the post-radiation necrosis, both the mucositis, the skin reactions, radionecrosis, things like that. As far as the chemos go, it's still open. I think it depends on the type of cancer. And like with mammary cancers, they've found it to be very helpful. But I forget the other types that they worry that it may actually be causing problems. So it's still debatable.
Your tick-borne diseases. What were you saying? Have you treated any person?
I've not. I mean, in human medicine, the big thing is Lyme,
Right.
which we don't see much of down here. I mean, they haven't really talked much about the Rocky Mountain spotted fever and ehrlichial diseases. There's something very particular about Lyme where it has to do with the susceptibility to oxygen. They kind of like a hypoxic to lower oxygen environment, and they basically protect themselves in the body. The organism protects itself in the body to avoid that oxygen level, and they think that might be part of the chronic stages of it. So they think that hyperoxygenating may be beneficial for that. As far as the other diseases, I mean, you know, certainly I think it's going to be beneficial with vasculitis and edema. It'll help potentially the body's immune system and antibacterial activities work. But I don't know how necessary it is. For the chronic conditions, maybe more so than the acute. Anything else? All right. So contact info, if you ever have any questions about hyperbaric oxygen, certainly just get in touch with me. We use it 24 hours a day. All the ER doctors, technicians are all trained on it. It's pretty simple. You know, we've had some cases come down where, like, you know what, I just don't think it's going to be beneficial, and we send them back to wherever they came from. No need in keeping them. So what do you think? Snake oil? Not snake oil? Somewhere in between?
I'm sure there's something to it.
Something to it. I mean, I've been amazed by some of the effects, but then some of the other cases I've been far from impressed. Like I don't find the disc dogs to be walking a whole lot faster, but I think some of the trauma, like the head trauma I saw this weekend, I definitely think it made an improvement very, very quickly. So I'm trying to get a feel for what the difference is between these cases that you see an acute improvement neurologically versus the ones that I don't. I'm not sure yet.